Hello again, and today I'm going to talk about a very common condition that many patients and individuals suffer from, which is acidity. Now, acidity in simple terms is basically increased acid production within the stomach, and many of you will know that acid is required for normal digestion of food. So, what I'll be talking about here is how you can get rid of acidity with some simple tips. Now, stomach acidity is a common condition, and there are a number of reasons why it may occur. But the bottom line is that a lot of times just poor lifestyle and bad dietary choices are the most common causes. Now, in the medical world, we call stomach acidity acid peptic disease. Peptic usually refers to the stomach, acid is self explanatory. And when the acid comes up into the food pipe from the stomach, it is called gastroesophageal reflux disease. And sometimes we call it GERD, GERD. Now, you might have seen this in the medical notes. So, when you suffer from hyperacidity or increased acid production in the stomach, the common symptoms include excessive burping or belching, a constant feeling of nausea or a feeling of fullness in the stomach, loss of appetite could be one reason. Bad breath is a common problem because the acid trickles into the mouth at night when you're lying down. And this can cause dental caries and this can cause bad breath. And some people get a bitter taste in the mouth. Stomach acidity can be what is called a chronic problem, which is a long standing problem. And in some individuals, it greatly affects their quality of life. But the good news is that there are simple ways to get rid of acidity. So let's take a look at some of these simple ways. The first thing to do is cut down your meal portion size. One thing I commonly see is patients or people generally in our country love our food and we tend to overeat. And when we overeat, we stretch the stomach wall a lot more than we should be doing. And this can lead to excessive acid production. If you're looking to get rid of stomach acidity, then the best thing to do is to try and cut down how much you're eating. Now, if, for example, you have 3 meals a day, rather than have 3 full meals a day, try and cut down the quantity of food that you're eating and those 3 meals. If you find that difficult, or rather than cutting them down, other thing you can do is have more frequent meals. So some people have very small meal portions 5 times a day, so that way they don't get hungry in between and they don't tend to snack on junk food, which is also a common problem. What I normally advise patients is to just cut down the quantity of food that they add on their plate. So if you feel that you're around 75 to 80% full and you're at a point where you think, yeah, I could eat just a little more, that's when you need to stop eating because this amounts to overeating. So the best thing you should do is never overeat. The next thing is spicy food. Spicy food is a big problem, and a nice spicy curry certainly can make us all feel good. I know that we all love our curries, but the problem is that some of the spices that is present in these spicy foods can irritate the lining of the stomach, and this can increase acid release and worsen dietary acidity symptoms. Now, there are some clinical papers that have been published saying that this may not be the case, but generally, the experience with most people is that when they have a spicy meal, they tend to feel a lot more bloated, get a lot more acid reflux, and get very, very unwell sometimes. The key thing is to cut down the quantity of spice that is added. For example, if you're going out and eating food, you may want to order a milder dish than to order a spicy dish, though it might taste really good, because that can trigger acidity and it can be more of a problem afterwards. The next thing to do is stop smoking. Now, smoking has been strongly linked to the development of acid peptic disease, and smokers tend to have worse acidity problems than non smokers. Similarly, chewing tobacco is a problem. So, if you're a smoker or if you chew tobacco, then you need to stop doing so because even if you take medications, while you may get relief temporarily, it may not be a permanent solution unless you stop these habits completely. Now, being overweight is a common risk factor in the development of hyperacidity and with gastroesophageal reflux disease. So, losing weight through exercise is probably one of the best strategies you can adopt if you wish to get rid of acidity. Now, starting an exercise program can improve your digestion and at the same time, it helps you lose weight. Exercises can be simple ones, just as simple as brisk walking every day for about 30 to 45 minutes a day, jogging, swimming, cycling, or any sporting activity that gives you some sort of pleasure. Now, it doesn't matter what you do, just make sure that you combine whatever the exercise you're doing with a low calorie balanced diet. So, going out and exercising and then coming back and eating an oily, spicy meal doesn't really help. You have to combine your dietary choices with healthy dietary choices, rather, with a good exercise routine. And only then will you not only lose weight, but you may be able to get rid of acidity permanently. So it has been found that just losing 2 to 3 kilograms can make a big difference and can help you get rid of acidity. So if you can do, get on the treadmill like this young lady is over here, or start walking, start exercising, start using the stairs. Do something that will give you some form of physical activity every day. The other thing I advise patients is to avoid sleeping immediately after meals. Now, the problem with hyperacidity is once you have a meal and there is a lot of acid produced in the stomach, if you lie down straight immediately after a meal, that acid can trickle up into the food pipe and can cause GERD symptoms, that is, gastroesophageal reflux symptoms. So, this is particularly common if you have had a heavy meal, especially because the stomach gets stretched to an extent that the point where the food pipe and the stomach join becomes a little bit lax or loose, and acid can come back up the food pipe. This may cause nausea as well. Some people get very sort of bitter burps where the food comes up into the throat, and this leads to heartburn. So wait for at least 2.5 to 3 hours after a meal before you go to sleep. And this is particularly applicable if you're having your meal in the evening and then you're going to bed at night. So try and keep at least a 2 hour gap, but 2.5 to 3 hours would be ideal. Now, just in case that is not possible, and if you have had late dinner, this is very common. If you have had a late dinner, then you could sleep in this position. Now, this is a very rough drawing I have done with my hand, so forgive the rough drawing. What I have written over here, these are pillows, and you can see this gentleman with acidity is lying upright like this at around a 45-degree angle, and these are the legs, and that is the foot, if you're wondering. And the propped up position can actually help. So remember that gravity is your enemy. If you lie down flat, then there's a higher chance of getting acidity. If you're against gravity, there's a lesser chance that the acid that is present in the stomach will go up into the food pipe and cause GERD symptoms. So try and sleep like this for at least 2 to 3 hours, and maybe a little bit later you may want to change back to the position that you're comfortable in. Another one that can help is avoiding chocolate and alcohol. Now, some may have known that alcohol can cause hyperacidity, but maybe some did not know that chocolate can do the same thing. Now, a little bit of chocolate is not a bad thing. I personally am a big fan, but a little bit of chocolate is okay. But just make sure you make healthy choices, as I've explained earlier. Don't make it a regular habit. Once in a while, it is fine. Either way, if you're having chocolate and alcohol, they all have the property of increasing the quantity of acid that is released in the stomach, and they also relax the valve that is present at the lower end of the food pipe. And both these combined can lead to acid reflux. So, if you're troubled by acidity all the time, it is important that you give up alcohol as much as you can and stop indulging in chocolate on a regular basis. Another thing is avoid wearing tight clothing. Now, tight clothing that fits around the belly can put a fair bit of pressure on the stomach and the other organs. And if you have already got acidity related symptoms, they can only get worse. A good idea is when you sleep at night, wear some loose fitted clothing uh, when you sleep. So, this can prevent the strain or the pressure on the stomach and can hopefully reduce your acid reflux symptoms. So, getting rid of acidity related problems should not be hard. Just take the right steps that I have mentioned in this video, and you could avoid taking antacids for years to come. As always, I hope you find this video useful. If you have any questions or comments, you can visit the link in the description below and leave a comment in the article. Also, if you like this video, please do subscribe, because I do plan to upload more and more information videos as time passes. And please do like this video and give it a thumbs up if you have found it useful. Once again, I thank you for your time, and I look forward to speaking to you again on another commonly encountered topic, common problems in health. Thank you.